I've started the recording now, so I'll just bring the slides up. Sorry about that. Thanks.
Perfect. Thanks, Vicky. Sorry, I thought it's better to record for people that can't attend today. So hi everyone, my name's Claire and I'm the Learning Officer for Bristol Ageing Better. So to start this webinar, we first want to clarify what we mean by co-production in research so that we're all on the same page before we begin. So just starting off with co-production. Co-production as an approach means different things in different contexts, and it can get really quite complicated trying to come up with just one definition of it. But put simply, it's an approach and a way of working where professionals and citizens share power and to plan and deliver something together. So today we're going to focus on co-production within a research setting. And as is always the case in co-production, it can be done in many different ways. There's not just one way of co-producing research. So the Ageing Better programmes in Bristol and in Torbay are 2 of 14 Ageing Better programmes. And within this big scheme of work, each one took a very different approach to how they did co-production and research. So there was huge variation in how they involved people, the length and the detail of the research, how academic it was, and how the research findings were used. So the Ageing Better programme in Leicester, for example, had a team of community explorers who were supported to research any issue which mattered to them without any preconceived structure. While the Ageing Better programme in Greater Manchester, on the other hand, they gave small amounts of funding to local community organisations so that their members could carry out the research project over 6 months. So 2 very different approaches, and those are just 2 of 14. But today's webinar focuses on the learning from the Ageing Better programmes in Bristol and in Torbay. So now I'm going to briefly outline what co-production research looked like in these 2 areas first, before we move on to the main part of the webinar. So as you can see on the slide, in Bristol, the Bristol Ageing Better programme involved a team of volunteer researchers that were called community researchers. And these community researchers were all aged over 50, and they worked with the University of the West of England to research and evaluate a wide variety of projects that were funded by Bristol Ageing Better, and to write up the findings afterwards. And there were some shorter research projects, but on the whole, most were in-depth academic evaluations lasting 2 to 3 years. The size of the community researcher team in Bristol varied during the 6 years. Volunteers joined and left at different times, but there was a core team of 11 community researchers. While in Torbay, the Ageing Well Torbay programme was evaluated by a team of volunteer researchers that were called citizen evaluators. Again, these were all aged over 50, and they worked with the Serio Research Unit at the University of Plymouth. The citizen evaluators carried out a number of research projects, and their findings fed into Serio's formal evaluation of the Torbay Ageing Well programme. As with Bristol, the size of the citizen evaluator team varied a lot as well, but there were a core team of 5 citizen evaluators who have been involved since the beginning. So now you hopefully have an idea of some of the many different forms that co-production can take in a research setting. If you'd like any more information about the Bristol or the Torbay models, then feel free to ask your questions during the panel discussion at the end of this webinar. Can I have the next slide, please? Now, as we've said, there's a great value in co-producing research. So today's webinar will mainly focus on our top tips for supporting volunteer researchers once they've been recruited. However, first we want to briefly outline some factors to consider at the beginning before you even get to that stage, because starting with strong foundations is so important when you're doing co-production. So we're going to go through these really, really quickly now, but more information about each one will be available in our toolkit, which is coming out in May. So the quick foundation kind of points and recommendations we want to cover is to carefully consider whether the role of researcher will be voluntary or paid. There are pros and cons of each one, which again we go into in the toolkit, but within Ageing Better these roles were all voluntary, so that's why throughout this webinar we're going to call them volunteer researchers. You also need to decide which organisations are going to be involved in supporting the volunteer researchers. If you are not an academic or a research organisation, do you want to work together with one? While we appreciate it's not always possible, from our experience we do strongly recommend it. Third, be mindful of diversity when you're recruiting volunteer researchers and throughout the whole research process. This is really important because it affects the perspectives that you consider during the research and the analysis and the type of research questions that are asked. Plan in advance how the volunteer researchers will be involved from the very moment they're recruited, how you're going to engage them and maintain their momentum. So find out their interests, their motivations, skills and support needs so that you can adapt the role around them as much as possible. We found that volunteer agreements and a role description can help to make sure that expectations are clear, but these should be designed together with volunteer researchers where possible and be open to change as the role develops, especially over such a long period of time of 5-6 years, the role will inevitably change. And then our last point about the strong foundations is to make sure you establish the key outcomes and the purpose of the co-research really early on in the project, along with the audience that any research findings are going to be directed towards. And the same should be done for each individual research task as you go through. Having this clarity just massively helps with having a purpose and a structure for each research task that you're doing. And as I've said, we'll go into these points in lots more detail in the toolkit, but that was just a whistle-stop tour before we move on to the main focus of today's webinar, which is the support for volunteer researchers. Support is very key to the co-research being a success. One of our volunteer researchers in Bristol has recorded her thoughts on this in a short audio clip.
I was so grateful for the heavy lifting done by office staff at Bristol Aging Better and our academics. From the production of either paper or digital copies of documents on request and booking meeting rooms, to making initial contacts with research participants where appropriate, drafting outlines for reports and presentations where we were invited then to add our own contributions, and providing timely, ongoing critiques to fine-tune our research. This support left me free to focus on doing what I signed up for, to make a useful contribution to the research project itself.
I think that quote from Jenny really sums up why support is so important and it needs to be done properly to enable the researchers to focus on the research itself. So these recommendations in today's webinar are based on what we have found to work well based on our own experiences. There's more than one way to do co-production within research, but this is what we have found to be valuable, and we welcome your discussion at the end. And what we mean by support generally falls into three main categories. So firstly, the sort of technical support around the research process itself, the research side of things, the administrative support, and the support related to the well-being of volunteer researchers. So we will now unpick what this support might look like in practice, and I'll hand over to my colleague, Matt.
Hi everyone, I'm Matt from the University of the West of England. And yes, we'll come to the main focus then within this webinar, which is about sharing our recommendations for supporting volunteer researchers. And we split these up into 7 top tips. So, first of all, budget for support. In order to provide a package of support, you need to have an adequate budget. Volunteer researchers aren't a free workforce, and a budget is needed to cover costs such as for paid roles to provide support, training, travel costs, resources, printing, recognition, and many other things. So just because they are volunteers, it still involves costs and a budget is needed. One thing that can be surprising is that volunteers may feel embarrassed about claiming expenses, which of course means that there are hidden costs for the volunteer researcher, such as they're paying for the travel, for stationery, for printing things out. So it's good to establish a culture where all volunteer researchers are proactively encouraged to claim all of their expenses. And this can be done in a number of ways. For example, sending a monthly reminder for expense claims to be submitted, handing out forms at each face-to-face meeting, and generally minimising the bureaucracy involved. Second, paid roles for those engaging in the support of volunteer researchers. So there are some staff costs that need to be considered, because providing this kind of support does take time. Support is so vital for co-produced research to be a success that it can't just be an added extra on top of someone's role, especially if they're already stretched to capacity. So you need to be clear, for example, that staff have the time to read reports, comment on drafts, provide information on request, as well as building up networks through which the research can later be disseminated. You don't necessarily need one specific person whose entire role it is to support the volunteer researchers, but those who are involved in providing support should have enough capacity within their workload. And this support may predominantly come from staff within one organisation, or could be shared between organisations, as long as it's clear who the volunteers should contact, and that there's clear accountability. And it also helps to have a culture within your organisation of everyone being willing to assist volunteers. Another of the Bristol volunteer researchers has recorded her thoughts on this.
What really made a difference to our experience was the culture in BAB. We knew that if we rang up, whoever we spoke to would be helpful, they'd know who we were, and ensure that anything we needed was done. We were always treated as valued members of the team.
However, the support that's organised should be transparent to volunteers. They need to know who they should contact about any particular issue, and there's always clear accountability. And the support needs to be timely. Having to wait a long time for feedback or a long time for publication can be disheartening for volunteer researchers, which is why staff need the capacity to act. Next slide. So we're on to the next one here. So thirdly, adapt your communication methods to the individuals involved. So contact needs to be regular, but also to respect that volunteer researchers will have many other commitments. So depending on what works for the group, it may be useful to set meeting dates in advance, or explore the option of having online meetings or telephone conference calls. When meetings are in person, it seems obvious, but they need to be held in a venue which is physically accessible, easy access via public transport, ideally with car parking available. Recordings of meetings are essential to make sure ideas are followed up and progress is made, and those not able to attend are then kept up to date with those records. Discussions, it should be a kind of culture where there's an ability for people to have frank and open discussion, and that there's a regularity about checking in on the needs and expectations of all parties, and to keep maintaining that common understanding around roles and responsibilities. And it might also work well to have informal drop-in sessions just to discuss things face to face. Number 4, feedback loops. So feedback loops are an important part of co-research and can take a number of different forms. There's a feedback loop about the quality and the content of research. So in co-research, most of the volunteer researchers will have had no previous research experience, and it's valuable for them to regularly discuss the research findings as they emerge. For example, whether they could have done things differently at an interview, or if there were other angles they might explore. And this regular academic feedback, we could call it, is particularly valuable considering that most of the volunteers, they will have lots of valuable background experience that just needs to be aligned with doing the research. Another kind of feedback is about the impact of research findings. To regularly share information with volunteer researchers about their research findings and how they've been used and shared with other stakeholders. Any actions taken as a result and a wider impact of this. And this should help volunteer researchers see how they're contributing, which aids their motivation and enthusiasm. And then there's feedback about any other useful information found during the research process. Volunteer researchers are often in positions to pick up additional information or issues of concern which fall outside the research remit. But this information can still provide valuable insights for the organisations involved and acting as a bridge between organisations and the research participants. Okay, so now I'm going to pass over to Donna.
Thanks, Matt. So our fifth top tip is all around training. So many people who've had little or no experience of doing research can make a huge contribution to co-produce research, because everyone has life experience and can approach the research from a different perspective. So the right training can help volunteers to really feel confident in their role. It's really important that a comprehensive training package should be provided so that anyone can really be a volunteer researcher without needing any specialist research experience. We recommend meeting with each volunteer researcher individually at the start of their involvement to discuss their particular support needs and preferences, including visual, hearing or mobility needs. It's really helpful to have that knowledge up front so that you can tailor any training and package and really deliver a kind of bespoke training package according to the needs of your researchers. Research jargon. The world of research can involve a whole new language to become familiar with, and so a glossary of keywords and terms and what they refer to is particularly useful from the outset. You may also find that that glossary grows over time as the research develops. Another key tip is to really make sure that training provided is timely and delivered in bite-sized chunks, depending on the skills relevant for each research activity. Ideally, it should take place shortly before it's required, so that all of those skills learned can be used immediately and it's all fresh in everyone's minds. Regularly ask volunteer researchers what they would like training on and have an appropriate and dedicated budget to provide this, as Matt mentioned earlier. In terms of what the training should look like, we recommend training about how to develop research questions, skills for in-depth interviewing, focus groups, and also training around safeguarding and note-taking and all the ethical considerations. And these are likely to be useful depending on the role and the individual's previous experience. Some people will have knowledge of those things and some won't. It can also be useful to create opportunities for the volunteer researchers to share knowledge and learning between themselves. Ways to achieve that include having an allocated time to discuss this during meetings, but also building in opportunities for the volunteer researchers to socialise informally. And finally, on training, it's really important to work with each volunteer researcher individually to make sure that they are supported and encouraged to make the role their own. And that might involve one-to-one mentoring or creating peer support between volunteer researchers. Have the next slide, please. Yep. So next we have team cohesion and support between volunteer researchers. So team cohesion amongst the volunteer researchers really does improve the quality and enjoyment of the role, and it also creates a culture where the volunteer researchers can check in with each other directly, provide each other with peer support and resolve any challenges at an early stage before they escalate. It also provides them opportunities for volunteers to meet new people and develop friendships that transcend the researcher role. So team cohesion can be encouraged by working on a project in pairs or small groups, building social interaction into training sessions, and also having opportunities to informally socialise. In Torbay, we found that focus group role play within training sessions not only helped build skills for doing the research, but it also really brought the team together whilst having lots of fun and being rather creative. So if new volunteer researchers are recruited later on in the project, it's really important for them to feel included in the team and equally valued. It may help for existing volunteer researchers to act as mentors or to buddy up with them. And so the seventh and final tip is around recognition and appreciation. So it's really important to remember that the team are all volunteers who've chosen to give up large amounts of their personal time for free. These contributions should be recognised and appreciated. There's thank you messages, social events, and lots of tea, cake and biscuits too. Research can also involve a significant amount of pressure, particularly when there are external deadlines to meet, and as much care as possible should be taken to reduce unwanted pressures on volunteer researchers, and if necessary, take those pressures on within a paid role, making sure that the volunteer role doesn't start to feel like a job, and that it continues to meet individuals' motivations for taking part. I'll just pass you back to Laura.
Thank you, Donna. So that marks the end of the presentation part of this webinar. But before we move on, we would like to emphasise, obviously, that we have whizzed through our learning fairly quickly today in the interests of time. But obviously the toolkit resources will go into a lot more depth. If you do have any questions today, then please pop them in the Q&A box. But if you think of something after this webinar over the next few months before the toolkit is launched, then please do get in touch with us and we'll be happy to try and help. So we'd like to end this part of the webinar with an audio clip from one of the volunteer researchers in Bristol, just talking about the impact it's had on her.
Being a volunteer involved in co-production with BAB has been a very enjoyable experience. I have made new relationships and friendships, and I've gained in confidence. And the things that I've learned, I've been able to take into other areas of my life.
Great. So I think we will now move on to the questions section. So we do have some time dedicated to this, so do pop your questions in the Q&A box and we'll try to get through as many as we can. So I would now like to welcome our panellists for today. So you've already met Matt and Donna, but we also have Eddie and Margaret here as well. Let's go around the room. So Matt, obviously we've heard you today, but do you want to introduce yourself officially and tell people what your role has been within co-research with BAB?
Absolutely, Laura. Matt Jones, I'm an associate professor of public health at UWE, and I'm part of the Centre for Public Health and Wellbeing. And I've been involved with the evaluation of the Bristol Aging Better programme since 2016, and I started working with the co-researchers, the BAB community researchers, when they had already been recruited and started in their roles. So I joined about a year after they had started. So yeah, that's me.
Thank you, Matt. And Donna, do you want to introduce your role in Ageing Well Torbay?
Yeah, so I've got a very similar role to Matt. I'm a research manager at Serio, which is a research unit at the University of Plymouth. And we were commissioned to undertake the local evaluation of Ageing Well Torbay. And my role, as much as being involved in the wider evaluation, was also to help guide the assistant evaluators along this road of co-production. So yeah, it's a very similar role to Matt, and yes, you'll hear from Margaret about all what we've got.
Thank you, Donna. I'm going to move on to Margaret. So would you like to introduce yourself, Margaret, and tell us how you've been involved in Ageing Well Torbay?
Yes, I spotted an ad in the paper asking for citizen evaluators, and just as I was retiring, and I was looking for a variety of different things to get involved with. I had no idea what it was going to be. I didn't know about the Ageing Well programme, and I thought there was an opportunity for me to get to know more about the actual programme, but learning the skills along the way and about ethics, different types of questioning. I was a confident, sort of speaker and writer, but it certainly added to my skills, and I've definitely made new friendships, which have led on to other activities that I'm doing. So it was a really good move going along to that very first meeting.
Brilliant. Thank you, Margaret. And now, Eddie, do you want to unmute yourself and introduce yourself?
Certainly. I'm Eddie Knazel. I got involved in this. I wasn't one of the original research team. I got involved in it when things have been going on for about a year or so. My background is that I've actually become retired during the BAB. I was actually working a bit when I first got involved. And my background was that I was doing a lot of educational development work and research and evaluation. So I had some knowledge of evaluation work beforehand, but I've actually learned a lot through being involved in this. And it's been great because I knew very little about the whole Ageing Better process, and it's now a big part of my life, quite apart from the fact that I am aging better myself. But I mean, it's been, it's opened up all sorts of interesting things I'm doing nowadays.
Brilliant. Thank you, Eddie. Okay, so I'm going to kick off with a question about that initial period of co-research. So does anyone have any kind of top tips, I guess, for things to include in the first meeting? So once you've got a group of co-researchers on board, is there anything that you would particularly want to involve in that first meeting? I'm going to go to Donna for this one.
Yeah, I think that first meeting really needs to be about getting to know all of your volunteer researchers and who they are and what they want to get out of a role, and really understanding what their needs are, what they like to do, what they would definitely not want to do, and really just exploring all of their the expertise that they already have. I think that's key. We had in Torbay, we had such a wide variety of different people with different levels of expertise in different areas, and actually as a group they filled in lots and lots of different gaps. So we had experts in education, experts in public speaking, Margaret, and lots of we also had individuals who had done research before, but lots who didn't too. And it's just really just getting that kind of wider understanding of who the new team are, and what they want to get out of it. I think we had a discussion a while ago about how it's really important to be very clear about what the role entails, and what and not to fill it with jargon. I think that is really important. On a day-to-day basis we can talk about all sorts of researchy types of things, and actually it's not necessarily relatable. So yeah, it's really important to be clear and concise, and have that transparency.
Thank you, Donna. From a citizen's point of view, Margaret, how would you like that first meeting? What would you like that to involve?
Yeah, I think Donna's pretty much covered it, but I think this has been quite a steep learning curve for the universities as well as ourselves, because they hadn't actually worked with citizen evaluators before. So it has very much been a learning process. I think we had no idea when we turned up to the meeting what the process would be. And I think now, I think it would be clearer for us or for future, sort of, members of the public who are going to do something like this. I think it would be easier for researchers now that, we've got a toolkit coming up to actually look at that and see what is needed from the ordinary man in the street or woman in the street who is going to get involved. It was okay, but I think the meeting when those who'd actually volunteered turned up, that's when it all started, sort of becoming clearer. And I think the initial meeting where we had quite a big group, I think that could have been laid down more definitively what we were going to be doing and what the benefits to ourselves would be, what we would be actually be able to learn. And I think having someone who'd already done it in the past, rather than just a researcher up there, would be a real help in the future going forward.
Thank you, Margaret. Some great tips there. I'm going to move on. We've had a question about ethics. Someone says, could you please elaborate on some of the ethical and safeguarding considerations for volunteer researchers? Matt, do you have any comments about ethics and safeguarding considerations?
Absolutely. I was just reflecting on our top tips, and while it's really, I think it's really important to be enthusiastic about this whole field and to promote it, but I think in the back of a lot of people's minds they'll be thinking about what are the risks here, and what are the problems that can occur. So I suppose I would preface it that I think my observation is that it often slightly depends on the actors in the room, that some people have got a bit more of an appetite for diving in there and going with the risks, whereas others, and I have many research colleagues who would be very risk averse and would be seriously concerned about the research ethical issues that can arise in this situation. So I think it's that there's a number of responsibilities, and where there's an academic involved, we've got a very clear framework, and so would research agencies that are operating in this world, that there needs to be someone who has governance responsibilities for the ethics. And if I was a member of the community going into a project like this, I would want someone to explain to me, who has responsibility here. That person should have taken their proposals and their work to, in a university, we would take it to a research ethics committee. So there's a level of formality here that I think does need to be in place. Having said that, there are other scenarios where maybe a voluntary sector agency is running a research project which is rather like this, and they might have a slightly different point of view, but I think that their point of reference would be around all the good conduct that we know with regard to supporting volunteers. In fact, if you look at best practice for supporting volunteers in the communities and voluntary sector, you see a lot of crossover with best practice for doing research. There's a lot of overlap between those two areas. For example, around safeguarding procedures, it would be much the same. Or around the management of data, we've now got the GDPR. So it's the same fundamental issue: volunteer support and management, and researcher support and management. The ethical issues are very much shared in common, and I think we shouldn't lose sight of that. That it shouldn't be a mystery for senior staff within the voluntary sector or research sector to understand what they need to have in place. And finally, then, if you are someone taking part in this, you should get clear answers from them on that subject.
Thank you, Matt. Really in-depth answer there. We've had a question about co-designing the research. So someone's asked, what extent did each of the projects co-design research, and how did you manage that? Or was it effectively led by professionals only? Donna, do you want to start us off with that one?
In terms of the evaluation objectives, there was a kind of a remit in which we needed to work within, and then once we had that remit to work within, we then passed that back to our system evaluators to show. We went through at the very beginning, we talked through all of the different elements of Aging Well Torbay and the individual projects, and talked about, you know, what would be interesting to evaluate, what would what and how, and a kind of a brief overview of the different types of methods, and we did lots of brainstorming, and so it was you know, it was co-produced, so it was, you know, we did lead it in some respect, in terms of okay, so we've got this project and we really would like to kind of look at the impact of X on Y, but how are we going to do that? How would you like to do that? What would, you know, what do you think would be interesting to find out about this? And also using the system evaluators to actually their own knowledge of the area and the people within it, to really shape the research. So it was co-produced, but within a remit of what we had to report back to National Lottery.
Thank you, Donna. We've had quite a few questions in, so I'm going to move on to the next one because we've had some good ones. So someone's asking about the types of activities that volunteer researchers undertook. So looking at, I guess, in Bristol, Eddie, do you want to answer what type of activity you were involved in?
Certainly, yes. I think I was mostly involved in the qualitative aspects of the work. So the kind of things I was involved in actually research was interviewing people to a large extent. Also, to some extent, observing things and so on. I think other people were heavily involved in mucking about with numbers. Really nice scene, but I mean, there were elements of the work that were really quite numerical. I think the other thing that I would say in relationship to that is essentially that it's important to actually give people the opportunity to do the kind of work that they're comfortable with doing, because it does vary quite a lot. I know as our work progressed, the storytelling side of it became increasingly important. A number were not actually that comfortable with that, weren't thinking that it's really that solid a way of doing research. I mean, they're wrong about that, of course, in my view, but I think it's very important to kind of understand that sort of thing. Yeah, a lot of it was basically listening to people, watching and observing people, and talking about what I'd seen with my colleagues.
Thank you, Eddie. So I guess it's really important to be able to offer different types of activity for different researchers depending on their interests.
And I think that's one of the strengths of this whole thing, is that there were lots of different kinds of work as a researcher. And that's really unusual. It's not how things work when you're a professional. You don't have a choice in quite the same way about what you choose to get involved in.
Great. Margaret, what kind of activities did you get involved in Torbay?
We, I think it comes down to the name, with Bristol's researchers, Torbay evaluators, and we kept fairly detached from the actual Aging Well programme itself, because we were working to actually evaluate what was going on. I mean, we'd turn up to one of the festivals and we'd meet each other there because we'd gone along, because we were of an age to go along to an Aging Well festival. But I know we were all going around having a little snoop and thinking, oh, well, that couldn't go, well, we like that, and they could have done that better. But as far as what we were doing, we were various different projects, some which had a 1-year funding, some had 2-year funding, and some that have been ongoing. So we were actually interviewing people who were recipients of the Aging Well, sort of funding. So one that we're doing, a longitudinal study, that is carrying on. We're just about to go into our final interviews, which we're going to have to do through telephone conferencing. But the interesting thing was that the people that we talked to really seemed to open up to us in a way that they wouldn't to an official researcher with researcher questions and jargon. All our questioning was discussed with our staff from Serio. So we would get together a program of questions to go into an interview with, which the interviewee didn't necessarily stick to what we were expecting, and quite a lot of them just opened up and just ran with whatever. I'm doing one tomorrow and I know it will take twice as long as we expect, because she just loves to chat about what she's received through the program. So I think that's the interesting thing, is that it's the relationship between us as evaluators and the interviewees. We've done round table ones as well. That was a very that was the only one that didn't really work, but that was a challenge in itself, and I was chair for that one, and that was really challenging. But it's also valuable for me as an experience, and I think the people what came out of that fed back into the Aging Well program in Torbay, and they were able to make changes. So whatever we've done, it's fed back to Aging Well and to Serio, so it's fed into that wider.
Brilliant. Thank you, Margaret. That was really interesting. I think I'm just going to come to Matt for this final question, and it's really just about how do you balance between co-production and expertise? How do you tackle that and kind of make sure that it's equal relationship? Someone's asked about that, so I just wondered your thoughts.
Well, I mean, I think there's always a lot of learning here, and I think the more one does it, the more one learns. But I would say it needs to start with some values, and that would be about expertise taking many forms, including life experience and expertise which sometimes people bracket off a thing called research from other kinds of ways of having curiosity or exploring things or a desire to learn more. So research, I don't think, should be bracketed off entirely from other qualities that people have, and therefore that would be the reason why co-research is such a good idea, because you are pooling forms of expertise that you don't might get excluded in a conventional piece of research. That's always the platform for moving forward. But I think that there are some very specific aspects to co-research which need to be, once one's got those values in place, one needs to keep on revisiting them, because often people fall into roles where the experts feel that they're the experts and jump in, or the co-researchers feel that they're the amateurs and step back. So co-research is an ongoing process of constantly reminding oneself of the shared expertise in the room.
Thank you. That's a great answer. So we've got about a minute left, and so that we finish on time, I'm going to thank all of our panelists. Thank you so much for your thoughts and sharing your experiences today. We've had quite a few questions come in today, so what we'll do is take a note of those and we'll get back to people where we can. I will now pass back over to Vicky, but would like to say a massive thank you for coming today, and hope this has been really helpful.
Sorry, I've just unmuted myself there. Thank you, Laura, and thank you to everybody that's taken part today. And of course, everyone that's actually signed up to attend the webinar. As Laura said, we have got lots of questions that came through that haven't actually been answered live, but we will make sure that we answer those for you. I've made a note of all the ones that we haven't got round to answering this morning. So they will be circulated around everybody that's signed up today. So I'm just going to very quickly end the webinar now by just signposting everybody to the toolkit that will be available around this theme as part of our national online toolkit that will showcase all of the Aging Better co-production themes. And there's around 12 themes actually in total that will be showcasing within that toolkit. And we'll also be following on the learning at our Festival of Learning later on in April and May, where there'll be much more interactive style workshops, discussions and networking sessions that you can take part in, as well as lots of guest speakers that will be coming along to talk about different aspects of co-production from many different perspectives. So we're hoping that you'll be able to come along to that, or at least some of those workshops. And there are obviously some other webinars that we still have yet to deliver. The 8th of March is our next webinar, and we've got quite a few over the coming weeks that you can still sign up to if you haven't already done so. So thank you once again, everybody that's taken part, and we hope to see you again. I'm going to close the webinar down now.